Hello everyone, welcome. Today we are delighted to have Mr. Rajeev Sadanandan with us to have a brief discussion on India's fight against coronavirus and what lessons India can learn from Kerala. So without further ado, Mr. Sadanandan, considering India is almost now touching 13,000 cases, what do you think is the coronavirus endgame? How can India, overcome this pandemic in the best way possible?
The problem with that 13,000 number that you're mentioning is that we have no means of finding out whether that is the correct number or not. Unfortunately, maybe due to lack of test kits or other reasons, we do not have what we normally do in an epidemic, which is a sentinel surveillance system, which will help you estimate what is the size of the pool of infected. So we are literally flying blind. When you say 13,000, we know that there are 30,000 cases, but from the experience of Wuhan, Italy, and all, we know that the actual number could be anything from 20 to God knows how many times the numbers that we have. So the problem for anyone who's hazarding a guess on where the end game is going to be, or more importantly, how longer to the end game. Without numbers, I don't think anyone would be willing to hazard a guess on what is the size of the epidemic, what's the scale of the epidemic now, and where it's going to go. So I literally I can't even chart the course of the epidemic where it is going to go.
Okay. So if we see Kerala's coronavirus trends, we see Kerala has swiftly moved from a situation of doubling cases every 3 days to now flattening the curve. So I would like to know from your perspective, what difficulties Kerala faced initially, especially with respect to high number of tourists and the migrant movement.
You should keep the migrants out of this at all. Poor guys had nothing to do with it. Okay. We keep blaming the outsiders, and migrants always come up in infection. Right. Quite often they are the victims, and they're not the perpetrators. Unlike the other epidemics that I have managed in the past, the advantage of this epidemic was that the epicenter was known. We knew that there is a place called Wuhan. There are people from Kerala, India over there. They would come back, and when they come back, there's a high likelihood of they're traveling back with the virus. That was an advantage, and Kerala took full advantage of that. So all the people who came back from Wuhan, basically medical students, were quarantined. I mean, shortly after. Initially, a few days they were in the community, but they were quarantined. So it was a finite number. You knew who were the people who could have brought the virus in. You knew who the contacts were. So when the number is a finite number, it becomes easy to manage an epidemic. So that went on for a few days, and then something that other countries did not do, which was managing the virus carriers from China to their clients. So then Italy blew up, and then the whole of Europe started, which again wouldn't have affected Kerala that much. We did have a few cases, but that was manageable. But then Iran erupted. The problem with Iran is that Iran has got there are pilgrims from India who travel to Iran. That is not a major problem for Kerala. But Iran had in turn affected almost every Gulf country. Even the Sunni countries are affected by the epidemic in Iran. And that was a real problem for Kerala. That is also the area where the planning went a little awry. So but one good thing was that even there, the number of people who came were known. And while Kerala did not isolate them, they were home quarantined. And because of what the Kerala society knows about since the Nipah days, the necessity for quarantine, given the results that we've obtained, I must say the people who returned, except for a few celebrated or notorious cases, obeyed the request. Their contacts obeyed the request and stayed in isolation, with the result that practically every case, except one or two, practically every case who turned positive in Kerala were part of the people on your list. You can't imagine the advantage that is there when your infection is limited to the pool of people that you know. And that was Kerala's big advantage. So the advantage was, one, the Kerala health system knew what tracking and tracing was, and then had a system by which they could track and trace the people who could have brought the virus, people who would have caught it from them. Had there been enough number of test kits, Kerala would have gone ahead and tested all these people, and the infections would have been much, much less. But as luck would have it, we didn't have enough test kits, but the health workers continued tracking them. And the moment they got symptomatic, they were tested. And as a bonus, when the country banned international flights on the 22nd of March, that is the last day that people from the other epicenters came to India. And when the lockdown was declared, the people bearing viruses could not bring that to Kerala. So the advantage Kerala had was that the virus was known to be circulating in a defined population, and Kerala's health system was good enough to pick them up. They did, and that's where the results are.
So, but still, one obstacle that we seem to be facing in the entire country is that people aren't being forthcoming. Specifically because of the stigma surrounding the virus, people aren't disclosing the full extent of their movements. So, how do you think India can overcome this issue? And are there any lessons perhaps from Kerala?
See, one thing we need to understand in an epidemic is that you cannot use coercive measures and get full results out of a public health problem. Public health problem means public, that is the people have to be part of it. The advantage that Kerala has is that is not the so-called great health system, not the good governance that people talk about. It is the people of Kerala. The awareness that the people of Kerala have, and which can't easily be replicated even in states that have built good health systems. Kerala has done well, not because of the extent of your coercion that you have, of the forced lockdown and so on. It's because the people of Kerala realize that this is a dangerous disease and you have to take precautions, and can cause problems. It is not as if everybody was forthcoming, but thanks to the training that we imparted everybody post the first Nipah crisis, people knew the advantage of preparing a route map. In fact, the so-called route maps which were published had become a kind of cause celebrate in the state, and everybody is trolling and laughing about the thing. But the use of that was highly respected, and the fact that people did support this kind of tracking. Remember, it could have involved visiting places of disrepute, places that people don't want to disclose, and at least in one case, that's exactly what happened. But overall, even if the person who was the direct contact was not forthcoming, the others who were visited by this person were forthcoming. The whole community kind of generated this data. I guess what happened at the place that people don't appreciate how important it is to collaborate in an endeavor like this, and that this is a public good, and when people don't collaborate, everybody loses.
Yeah, right. So clearly, Kerala has been very vigilant in containing the outbreak, specifically with the use of data, technology. But we do know that Kerala has inherently, not inherently, but has had higher literacy rates, has had a good advanced medical system. So how do you think other states will, cope up with this, considering the lower literacy rates and the inadequate health system?
Well, it's not as if Kerala has access to the only good health system in the world. I mean, in India, many other states have good health system. Tamil Nadu, for instance, has a good health system. And I know that Tamil Nadu is planning to, is kind of geared up for a much larger epidemic. Mumbai has a very good health system, but Mumbai is catering to the numbers are so large, and Mumbai is also catering to the rest of Maharashtra. We do not know how strong the other health systems are going to be. But the lessons that this and other epidemics have taught us is that unless the population knows what the dynamics of an epidemic is and how important it is to collaborate, it becomes very difficult to contain an epidemic. I'm afraid that lesson is going to be taught to us in a fairly unpleasant manner over the next few days. So going forward, what should you do? I think we need to strengthen our primary health system. We need to strengthen our, look at the number of vacancies that are in the primary health system across the country. It's the least important area for our health system. Look at the number of, and come back, look at what's the vacancy in Kerala. It's almost zero. So how about your warriors in this? They're not, your warriors are not your intensivists. Your warriors are your primary care people, your multipurpose health workers, your ASHA workers in the field who maintain the link with the community. I hope this would be a good lesson for us going forward in one, strengthening our primary health system, two, investing in our frontline workers and not and realizing how important they are, and for the frontline workers to build up their relationship with the community so that the community comes and asks for immunization. The community comes and asks you for hypertension and diabetic drugs, your TB. So if I believe Kerala's health system gets a lot of credit for what the people of Kerala are doing. And that is what other states have to build up.
Yeah. Actually, Kerala is currently, contributing to 14% of the total recovered cases, and it has only about 3% of the active cases. So, and this is a big shift from being the epicenter, the COVID epicenter in India. So, what do you think?
When was Kerala called the COVID epicenter of India? I don't remember that.
It started with that.
So, no, we picked up the cases. We didn't have the epicenter. What is now coming out is that other places had much larger numbers, but Kerala was actually looking for them. They were not waiting for people to come up. So please don't call Kerala the epicenter of the epidemic. It was never that.
But what do you think is the Kerala model? Like, what has worked for Kerala? And what can we take from them?
When I'm asked this question, I generally start off by saying, it all started in the 19th century. People say, no, we can't go back that much. Tell us what has been done now. Now, unfortunately, it is a history of the health system in Kerala that accounts for it. And it didn't start yesterday. It started in at least as late as 1830. So compare that to what happened in Tamil Nadu. Tamil Nadu worked on the supply side and achieved a tremendous improvement. But the demand side part is something that, as I mentioned, will have to be given attention to and worked out over and over again. You will need to make health a part of your curriculum right from the primary class onwards. You have to ensure that your community level health workers actually go out and teach people the need for immunization, the need for getting your blood pressure checked and all that. That's the kind of shift that other states will have to make to reach where Kerala is. And it doesn't happen during an epidemic. It has to happen all the time.
Yeah. How do you think are private hospitals and public hospitals working together? Like, are they working together to mitigating the crisis?
The strategy that Kerala has taken, and I believe many of the other states are taking now, except Tamil Nadu, I think, which is brought in the private sector right from the beginning, is that the public sector will take the entire load. These are lessons learned from the past. Surat had a very strong private health system when the plague hit, but ultimately it was left to the public health system to handle it. So the tradition Kerala has been that the government system is the first line of defense. Unfortunately, the government system is very strong in Kerala, but the planners have anticipated that it's quite likely that the first line could get breached. Then there's a second line of government facilities again, which will be the converted facilities that will handle it. If that also gets breached, the private sector, which is almost 3 times the number of hospitals in government, are in the private sector. So that line of defense is always there. So there's a three levels of defense against the disease that's been built up, which is why Kerala's, as I predicted in the beginning, I don't expect Kerala to have a major problem, even if the numbers are much larger than what they are now.
So finally, we just announced we just extended the nationwide lockdown. What are your thoughts on that? Like, because we know it will have an economic impact, but it is also necessary. So what do you think about that?
No, the problem is that look at what Germany or Sweden or Switzerland is doing. They are expecting the population to take care of themselves because they're confident that even if it doesn't happen and if the surge goes up, so long as it doesn't reach the Italy or Spain levels, they will be able to manage. They also have other strategies standing by. The problem for health planners in India, I suppose, would be that if a surge like that happens, we don't have the capacity to deal with it. I guess initially we were not as vigilant as we should have been, in spite of a lot of people advising the government that what happened in other parts, Italy, Spain, England, US, the number is, and China to start with, could happen here, and we should take necessary steps. At a certain point of time, when the planners looked at the data that was coming in, they realized the possibility that the system could get deluged. So the lockdown was a response to that, and I think to some extent it has succeeded in stemming the tide. As I've mentioned before, we are still flying blind. We do not know whether since we don't have the system to pick it up, we still don't know whether the epidemic is spreading in the community and we are not picking it up. So it was a foregone conclusion that the lockdown could not be lifted on the 14th of April. Now, the big question to which I believe no one has an answer is where we'll be on 3rd of May. Because, unless the response goes up, your numbers start improving. We still don't know whether where we'll be on the 3rd of May. But the calibrated approach the government has taken is to release some of the restrictions on 20th, and you'll find a large a number of people coming out. And from from April 20th to May 3rd, there is adequate time to judge whether the easing of restrictions has led to an exponential growth of cases. And I wouldn't be entirely surprised if, based on the data, government decides to further extend it if needed. Because frankly, India does not have many other strategies to use.
Yeah. So thank you so much for your valuable insights, sir. It was a pleasure to have you with us. And thank you everybody for watching this video. If you have any views, suggestions or comments, do post on the video. We will definitely get in touch with you. Thank you.